Welcome to the presentation on Juvenile Rheumatoid Arthritis, often referred to as JRA. In this presentation, you will find out about the disorder, some of the symptoms, educational implications, and some strategies that may be helpful in the classroom. In order to be considered JRA, there needs to be a joint inflammation for at least 6 weeks in a child who is 16 years of age or younger. Most of the time, the JRA is not a lifelong disorder, and frequently the symptoms will fade after several years or months. It is thought that JRA is an autoimmune disorder. Basically, this means that the body attacks its own cells and tissues. Why this happens, we are not sure. Both heredity and environment seem to play a role. The inflammation causes redness, swelling, warmth, and soreness in joints. Many children with JRA do not complain of joint pain. Any of the joints can be affected and may limit the mobility of affected joints. One type of JRA can also affect the internal organs. JRA is classified into 3 different types: polyarticular, polyarticular, and systemic. The diagnosis is based on the number of joints involved, the symptoms, and the presence or absence of certain antibodies found by blood test. The classification helps the physician know how the disease will progress. In polyarticular JRA, 4 or fewer joints are affected. Usually the larger joints, such as the knees, are affected, and sometimes eye inflammation develops. In polyarticular JRA, many small joints, such as those in the hands and feet, are most affected. Systemic JRA is also known as Still's disease. In systemic JRA, many areas of the body, including the joints and internal organs, are affected. Symptoms include joint swelling, fever, and rash. In JRA, periods when symptoms are better or totally disappear, it is called remission. When the symptoms are worse, it's referred to as a flare-up. Each child with JRA is different. Occasionally, 1 or 2 flare-ups occur and they never have symptoms again, while others have many flare-ups and sometimes symptoms never go away. JRA treatment focuses on keeping the child's level of physical and social activity normal. To help achieve these goals, physicians recommend treatments that help reduce the swelling, to allow for full movement in the affected joints, to help relieve pain, and to identify and treat and prevent any complications. Most children with JRA need medication and physical therapy to help reach the goals of maintaining normal activity. So what are the symptoms of JRA? They include joint swelling, pain, stiffness, limping, limited movement, slow movement, fever, and skin rash. Additional symptoms to watch for include swollen lymph nodes, eye inflammation, growth problems, weight gain, prolonged absences, emotional problems, increased stress, and depression. What are the educational implications for a child with JRA? Depending on the symptoms, a child's participation in social and after-school activities or even completing homework can be very difficult. If the child's mobility, strength, and endurance is affected, they will have difficulties with writing, participating in phys ed, playing in the playground, or other activities requiring the child to use joints. Students come to school with varying degrees of pain and stiffness. Some children need to take a warm shower before they come to school to loosen up. This will depend, again, on the symptoms and the severity of the JRA. Another educational implication is the irregular absences. If a child has a flare-up, his pain and swelling may be too much for him to handle in the school setting. It's important to understand how a student may be feeling. Children like to be like their peers, and because of the pain and the fatigue, they may not be able to participate at the same level. They can feel isolated and insecure. Sometimes they're angry and depressed because of the restrictions that are imposed upon them because of the disease. Some children are embarrassed and will try to do activities even though it is very difficult and painful. What are some of the instructional strategies and classroom accommodations that may be helpful for a child with JRA? Always remember that the student is a student first. Treat that child as much as possible like other students. Consider developing a medication plan to alleviate some of the pain a child may be experiencing. And encourage that participation in physical activities, remembering that you'll probably need to modify some of these activities based on what the doctor or physical therapist recommends.
Teachers can provide a variety of instructional strategies and classroom accommodations to help the student be successful. For example, the schedule can be adjusted. Extra time can be given the transition between classes. Stretch breaks can be allowed to relieve stiffness. And depending on the symptoms, perhaps the student may need a different chair or desk.
Children may not tell you when they are having pain from the arthritis. You may see them not completing assignments or taking breaks instead of staying what might appear to be focused on the work. Keep this in mind and consider extending time for written assignments or tests or allowing them oral responses. Tools that might help cushion the writing, maybe foam shells to build up pens or pencils, and there's a wide variety of other assistive devices that can reduce the pain and stress for children with arthritis. Computers or other electronic devices also help ease some of the pain and allow for more written production. For children who need to take a lot of notes from overhead or even writing assignments from textbooks, it would be good to give hard copies to that student. Remember, shortening or modifying long assignments may also assist that student during a time when the arthritis is giving them more difficulty. Another helpful accommodation for a child with JRA is to provide an extra set of textbooks that the child may keep at home. This eliminates the need to carry heavy loads of books back and forth to school each day. If a child is absent from school because of the JRA, arranging to make sure the assignments are sent home will help the child keep up with lessons. The school nurse may develop an individual health plan to help address the child's needs with JRA. The child may have prescribed medication that he or she needs to take in school, or need hot and cold packs to help address stiffness. Each child with juvenile rheumatoid arthritis may be a little different. It's important to know about each individual child. There are many resources out there available to also help you learn more about JRA. The following is a list of a few of the resources available.